And I had friends who were ahead of me. In fact, one, she passed away last year. It was very sad. We first went into the anatomy lab.
Yeah.
Some guys never came back.
After you see dead bodies, you're like,
Yeah, guys never came
this
back.
is not my path.
Yeah.
Welcome back to DDwithMaqC. It's a new year, it's 2024, and we are at it again, documenting stories of living stalwarts and individuals who are shaping the future of impact, individuals whose own lives have caused significant impact. And to start us off this year, we have someone who community health is at her very core. She leads one of the largest indigenous NGOs in Kenya, and she's contributed a lot to the triple threat, to addressing the triple threat in Kenya, which is HIV prevention, teen pregnancy prevention, and gender-based violence prevention. She's a medical doctor, but more than just a clinical expert, she's also a passionate advocate and a fierce champion for the marginalized. She's been a role model for many, leading an organization of more than 300 staff, and her focus on empowering individuals, particularly women and young girls, through different initiatives that the organization leads, has brought about a lot of change. She's a Trocare Romero Award winner in recognition of the efforts that she spearheaded to protect vulnerable communities from COVID-19. She's a leader, a wife, a mother, and she has a lot of empathy for the community. And ladies and gentlemen, today we are joined in studio by Dr. Lilian Otiso, the Executive Director at LVCT Health. Karibu sana, Dr. Otiso. I hope I've done justice to your introduction, which probably is, what I've done is probably just a small part. Welcome to DDwithMaqC. We are privileged today to have the honor of documenting your living legacy. And so you can say hi. Is there anything I've mentioned? Is there anything I've failed to mention that you would like us to know about yourself before we go back to where it all begins?
Thanks, Maxi, and thanks for having me here. It's a pleasure.
Karibu.
I think you've covered it. Sounds quite impressive.
You can see it from another eye.
Yeah. Anyway.
Yeah.
And yeah, good. Thanks for giving me a chance to reflect.
Right.
And for those who don't know, Maxi and we crossed paths at some point.
Yes. Yeah. She was my boss and continues to be someone I look up to very, very highly. When I worked at LVCT Health some years back, she was the director of programs at the time, and I was running the youth program. So I reported to her, and I learned a lot from Dr. Otiso. So let's go back to where it all began. Your roots, actually. What are your roots? Where do you come from? And then a bit about your birth and upbringing.
Wow. Okay. So I'm over 40. So over 40 years ago.
Yes.
And I was born in Kenya, here in Kisii, actually.
Kisii.
Yeah.
Right.
That's where my parents come from, and that's where they were working.
Both of them.
Yes.
Right.
So stayed there for a while, then moved to Nairobi in early 80s. And then one of the interesting stories I remember, and I'm the third born of 7 children.
Oh, wow.
Yeah. So.
Right.
It's a large family, but we're very close-knit, so I appreciate that. One of the early memories I have personally, or I hear my sister saying, she was older than me, is when we moved to Nairobi, we were only speaking Kisii.
Oh.
Yes.
Look at that. But Kisiis are known to speak very good English and Swahili.
And now I can't speak Kisii, sadly.
Oh, wow.
So, but the funny thing is how kids mocked us, because we're living in Buruburu and they would make fun of us and like how we're speaking. So I think that made us quickly forget, at least me, the older ones, my sister remembers.
Right.
I kind of forgot, but I can understand. I just don't speak it. And I try and speak a bit. I've been trying to pick it up over time. So with that, growing up, I grew up basically in Nairobi. In public schools those days, that's where we all went. It was interesting. I went to primary school in 3 different primary schools. One in
Kisii.
No, I was too young.
All in Nairobi.
Kisii.
Okay.
Yeah. So all in Nairobi.
Yeah.
I remember I went to a school in Bahati that I didn't like.
Which one?
Bahati Uhuru Primary.
Bahati Uhuru. I schooled in Kimathi Primary, so
the
we're just
neighbor.
neighbors.
Yeah. So that was my class 1. And then we moved. My parents were civil servants, so we moved to Kileleshwa. There are civil servants' homes there.
Right.
And that's where I went to Kileleshwa Primary and subsequently Lavington Primary.
Okay.
That's where I finished my class 8.
Yeah. What do you remember about those early years before, both at home and in school?
It was fun. We used to just play around in the neighborhood.
Siblings. Yeah.
My siblings, the whole neighborhood, we were all friends. A lot, it's so different now. So it was nice that you could get out of your house, go 500 meters to find your friend, or 1 kilometer even. It was all one big community, playing around, having fun. But I was always neat and organized.
You are the neat. It manifests much later.
So
I can imagine then for the games that you probably used to play, there were also organized games, shake.
Of course, yeah, and Kati. And then my sister would be the fun one. So she would drag me along, sister. My elder sister. Yeah. She would drag me along so that she doesn't get in trouble.
All right.
Because she's going with me, who is going to do the right thing.
Yeah.
Anyway, but we still maintained that friendship in spite of.
What do you think? Because is one of your parents neat and organized, or where do you think that is it, or was it just a natural instinct for you to be?
I think it was just a natural instinct.
Yeah.
I don't know. I've never thought of my parents that way. So it was natural. So they all thought. In fact, there's an uncle who used to call me Muhealthy.
Healthy
in Kisii, Kisii, whatever. And like, you see, she's so healthy. This one is going to be a doctor. So that's how the whole idea of being a doctor came about.
Yeah.
So I would play in moderation. I would do everything moderation. I liked staying at home. I liked reading books and stuff like that.
What kind of books?
Any. Those days, of course, it was the usual famous five.
The fiction books.
Yes. The boys. So I read those and whatever I could get.
Yeah.
I read a lot, but slowly. So I can't say I read too much. So I would just read what I come across.
And in school, what sort of were your favorite subjects, and also your other things that are not academic?
My ultimate favorite subject has and always will be math.
Math.
Yeah.
Right.
Always loved math.
Yeah.
And I did well in it, and sciences. So I've been a scientist all along.
Very nice.
Yeah.
Any extracurricular?
No.
None?
Not well. Very little. In high school, I joined the choir and I liked it. Yeah. And
which was the high school?
Precious Blood.
Oh, okay. So, all right. So you cleared your grade 8.
Yeah.
Then.
And went to Precious Blood. And that was tough. That was very tough. So my being neat and organized meant that I'm a softie. I did not like to be punished. I did not like to be beaten. Yeah. All those things I really hated it.
Right.
And my diet was in spite of us being 7 children, my mother always had to consider what I am eating.
Oh.
Because I was very picky.
Right.
Well, I gave birth to a very picky son, so it's gone through the generations.
Yeah.
So going to PB was a culture shock.
Yeah.
I had to eat cabbage, which I could never eat. Actually, I never ate it even then. It was just too bad.
Yeah.
What else? Blueband. I never used to eat blueband before I went to high school.
But now it's the thing.
I learned how to eat it in high school because we were allowed very little. Blueband jam. It was very limited diet and things that we were allowed. So I toughened up. I really toughened up. I went through
a metamorphosis of sorts, eh?
Yes. I remember, I kind of remember that the whole adolescence period, I was very angry because I was very angry in school.
With all this culture shock.
Yeah, and how tough the school was. It was, everybody knows how PB is. But at the same time, there's a lot that we learned there.
It was, and I guess continues to be a really well-performing school.
Yes. So that focus on performance, on actually the theme or the motto used to be, I will do the ordinary extraordinarily well.
Oh, that's nice.
Yes.
That's really nice.
So it sticks. Once you say that once you recite that for 4 years, it sticks.
That's a good motto, right?
Yeah.
Yeah.
So, I mean, you learn those and you learn to focus on your education, some extracurricular. I was not good at sports, so I did choir, which I enjoyed. I think that's it in terms of the extracurricular.
And you also morph in though as an adolescent.
Yes.
You're discovering life. How was that journey for you? Besides just being pissed?
And I was not rebellious or anything.
Yeah.
I was just there, school, home.
Yeah.
Holidays, I used to love watching telly a lot. I could absorb hours and hours.
What were your programs at the time?
I see the usual. Remember, those are the times of the soaps and all those things.
The Bold and
the
Beautiful,
Bold, the Days of Our Lives.
Also Cry.
Yeah.
Yeah.
So I watched those, and then one day I sat and I told myself, these things are making me stupid. Because how does someone keep resurrecting over and over again? And that's how I stopped. It was just...
That's true. At some point, they wouldn't make sense.
I was like, no, this is stupid. And the other stuff that would come up, I don't remember what there was. So it was just music. I liked music. I enjoyed the hip hop, the R&B.
Oh, that kind, not the African.
No.
I would have imagined you probably then it would have been Utna. So it is Jamadelic and those kinds of programs Jimmy Gath would host.
There was that. My bro was into hip hop. My sister was into R&B. So I listened to what they listened to. And yeah, I enjoyed all that. I liked it. I was in high school when Tupac died, and I remember how it was such a mourning period in the whole school.
It was, yes. Yes.
So that's the kind of music we grew up to. I remember my parents listening to ABBA earlier, like in the 80s and stuff. So I've been listening to ABBA recently, just remembering that those are things that...
Connecting back to the past.
Yeah.
Right. Very nice. And any other monumental thing, especially in your high school years, that you may recall, reflect, any thoughts you're having that you can pull on and find today they still have a thread? I
don't know, I'd have to reflect deeply on that. But one thing I remember is how I survived high school is that when you open, you count down to midterm. When midterm comes, count down. Because it was a matter of when is this going to end and what is next. So I was really looking forward to the next thing and the next thing. So, and that's how I am. Generally, I'm always looking forward to, I get bored easily. So what's the next thing? How am I going to get excitement from it?
It's interesting,
So it's what kept me going, because it was a matter of, it's really tough. How do you cope? So it was that, and then friendships, just listening to people and their stories. We were very good friends. We made friends. We're still friends up to now.
That's very cool.
The class was, we used to have 2 streams of 45 each, so we're 90. And you know everyone, and you know everyone in the whole school. So it's good when you meet people now and you really knew the whole school at that time. So just reflecting on those lessons, what did we learn? I know there are difficult parts there, and I've talked to people who, it's one of those schools where you really come out and you're like, wow, I never want to go back. But when you reflect as an adult, you're like, there are certain lessons, there are certain things we did which really brought us together. We used to have to go for mass every Sunday, and then at least once during the week. And to prepare for that, we had to sing. We had to have hymn practice on Saturday. Just remembering that. And I realized I really enjoyed the hymns. And those things now, when you start listening to them when you're older, you really appreciate that. And then you appreciate the discipline that it gave you. To be, I really got a lot of discipline there, to be hardworking, focused, and to just do the right thing and to do the extraordinarily well.
At that time, you knew that you wanted to be a doctor?
No.
No?
No.
Okay. So how did that transition come then?
I wanted to be an engineer or a computer scientist or something. But because they had been calling me the healthy one, and my parents wanted a doctor.
None of the other siblings?
No, that's not interested. And I got the marks. That's how I ended up doing medicine.
Right.
Yeah. But it wasn't bad.
Yeah. How's the transition year for you after high school?
The 2 years.
Oh, it was 2. Actually, they used to do 2 years.
Yeah. So I worked for a while. I worked in a pharmacy near home for a while. That's what I did mostly. And there's a time I started doing accounts the way everybody started, but then when I got the job, kind of dropped it.
Yeah.
Now in retrospect, I should have just done the evening classes and continued to work.
Yeah.
Because I still involve myself a lot in accounts and finance.
Yeah.
but still, it's fine. So that's what I was doing. So I learned how businesses are run, how to deal with customers.
A little bit more about medicine.
A little, about medicine and stuff like that.
Then now you went to UN?
I went to University of Nairobi, Chiromo, and that's where I did, those days it was 5 years.
Yeah.
We first went into the anatomy lab.
Yeah.
Some guys never came back.
After you see dead bodies, you're like,
guys never came back.
This is not my path.
Yeah, I was fine.
Oh, wow.
I was okay. Went on.
Wow.
The thing I've seen with they didn't scare me. In fact, it was a bit fascinating. And then we would have a group of us, like 12 people, have one body to dissect and go through the different parts. So we all had our parts. Some of us would be reading the textbook, someone else would be cutting and stuff. Yeah. So one interesting thing I did that time was my entrepreneurial spirit, which has not kept on, unfortunately, that came up was that I discovered we needed gloves to handle those bodies.
Right.
And no one had access. So I learned how to, my friend and I learned how to buy from the supermarket and come and sell.
At like a marked up price.
Per pair.
Yeah.
To students during the nurse class. Yeah.
That's cool. That's cool. And after you experience anatomy, which is the first year, right?
First year. So first year was, first of all, you've been out of school for 2 years.
Yeah. And
you just get back into the system, and it's tough. Trying to learn, and you're learning difficult things. There's anatomy, physiology, biochemistry. Biochemistry was the killer. I remember we did the first exam, and a lot of people scored like 30%, 20%.
Oh, wow.
And these are people who are all used to getting high marks in high school.
Yeah.
So it was quite funny.
Did you move with any of your previous friends and students?
Yeah.
Quite a number.
I mean, PB, of course, gives out many people from we were about, from PB, we were about 10.
Okay.
Yeah,
the
which
ratio,
is significant.
Male to female, was it something at the time that?
No, it balanced.
It's balanced.
I think it was from our year or just or the year before that it finally started balancing 50-50. So we never felt male.
Different,
no, we didn't feel.
That's good.
Yeah. So it wasn't a threat that, no, we're too few.
And you support then you're also able to support each other through this very difficult physiology, biochemistry.
Yeah. I think we joined, how many joined? Anyway, by the time we graduated, only about 100 or so. And I think 400 had joined or something.
Oh, wow.
Anyway, it was high dropout rate, starting with anatomy and then now moving on to things like biochemistry, which made a lot of people fail. I was lucky, I passed. As I mentioned, math, chemistry, these are things which I like. So I enjoyed that. And survived through it.
Survived through year one.
Yeah. And all the other 5 years. So first 2 years was Chiromo. And then we moved to KNH from the 3rd to 5th year. In terms of hostels, I was I think I did almost all the hostels. I would move every time.
Stella Awinjo.
No, I didn't do that. So I did Box, Hall 12, Chiromo.
Yeah.
Chiromo was very nice hostels. But for some reason, I felt claustrophobic.
Oh.
It's so weird because it's a very closed place.
Environment.
Yeah. And then there was some insecurity around there. So I always used to feel like,
uneasy.
It was a very strange feeling because I'm not necessarily a very outgoing or that I would be going out all the time.
Even then, I mean, this is now you are a young woman, you're in campus. There's a lot of. So
for me, like the life in Box, even if I was not very active or Hall 12, it's nice watching other people's.
Right.
It was a very active place. And we would have to walk from those hostels to Chiromo. And that was interesting.
Yeah, that's all through.
Yeah.
Year 3 to 5, how were you? How did that go? How are you performing? What adventurous things within academia were you seeing?
So first year was hard. Second year was easy because we only had one examinable subject. So everybody used to enjoy themselves so much and just take our time. So we had a lot of fun. We would do the usual things, movies. What else? Kani was, of course, the plan.
Yes. That was it, actually.
The soul night,
that was big.
whatever's. We used to do that, a bit of Kenchik.
Kenchik in town.
Yes, Kenchik in town. I think that's why Chiromo was just too far.
Yeah.
From
right, actually, when you think about it, you have to walk all the way where
it was Kenya Cinema time. Yeah.
So CBD was your place for
activities.
For activities.
Yeah.
Yeah. Okay.
So then we moved to Kenyatta, and then now you start focusing. You start going to the wards, and you start experiencing that.
How was that?
It was quite interesting, and you start seeing really, really sick people, and you start understanding the meaning of why you're doing medicine. So I didn't care to do medicine in the first place, but I didn't mind it when I did, and I found that, I don't know, I was fascinated by the social aspects, the suffering of people, how people are very poor and suffering. HIV was a big deal then that used to cause most of the admissions in the medical ward, and it was very depressing. That was quite...
You'd see someone who was healthy completely deteriorate. Yes,
or the ones who were admitted there, they had a look, and you just know. First of all, you know this is HIV, and then you also know the look when someone's about to die. You start sensing, you can tell, and it's very sad.
That must be hard also now for you as a human, like just experiencing this.
Yeah, but we were taught a bit, but not in details. But you start learning how to... Okay, you fortunately, we were not small classes, so you would have your group that you're doing the ward rounds with. And so you'd always have your support system from your colleagues and your classmates. So talk about it. But you start learning these things, and it's profound. And then now you also focus on your books. The thing with med school was also realizing that as med students, your life is more book focused, less fun. The BA, like when we're in Hall 12 and whatever, were with all these BA students who had proper lives.
Evenings and weekends were what for you had to be in books at that time.
But I didn't mind. I'm not the life of the party, so I don't mind that I don't have to do. In fact, I think the pressure to have a social life in university, I think is tough for students. The pressure to have a social life, the pressure to have everything, to be able to live, to get money. I did see a lot of that issue of transactional sex. We saw that
even with students.
Yes, people that we even know. So again, those become things that get into your mind when you get into the workforce. You're like, okay, I remember how it happened, so I can understand why we need to address issues of transactional sex with university students. That pressure, someone has come from a poor family, wants to conform, or is even looking for money for food.
Just maybe even just to get by, right?
Yes, cohabiting with their boyfriends and all that. We even had cases of abuse, but there's nothing we could really do, or we thought that we could do then. Those people who are even cohabiting with their partners. So it was just...
What was the... When you mentioned that, that's the social context of your campus life. Politically, how was Kenya at the time?
Oh, in campus we had Mad Max.
Yes.
The Mad Max was the guy that was his name, yes. He used to cause all the riots in University of Nairobi.
Were you ever caught?
No.
In those?
No, fortunately. There was a strike in first year, and then he was them and a group. Magoha came in, and people now expelled, and things became calm.
Prof Magoha is just...
Things became calm. I hadn't even remembered that the whole transition from Moi to Kibaki happened when we were in campus. But I think as med students, either we are sheltered or something, we're really not. And I was not in the student bodies and the student council. So that political feeling we wouldn't engage. Yes, but we voted. We made sure we voted and participated in all that. And all that time you'd be closed, you'd be at home just watching things. So it was exciting seeing all those changes.
I mean, you lived in campus, yes, but did you have
I was boarding. I was boarding in campus.
And then going home over the weekend?
Yeah.
Okay.
Yeah.
Because it's just nearby.
Well.
No.
Yes, it was nearby, but I wanted that
freedom. Yeah.
And we would study late into the night. And I had friends who were ahead of me. In fact, one, she passed away last year. It was very sad. Catherine Rabala was a very good mentor. She was my roommate in high school, and she's the one who even guided me. Even when you go register in first year, she's the one who was telling me, this is how you do it, this is how you get a room, and then this is how you study, this is how you focus. And that helped me a lot.
Were you but you're close with your siblings and your parents. Were they like, was there that we can jump in anytime, we can come?
No, hardly. On the contrary, now it's that I was in campus where I saw my true personality self-emerging, where I am a nurturer. I take care of people. So my room would be like that room where everybody comes for consolation. Yeah, or just hanging out, or just relaxing too, or study group. So you started like your social life is blossoming, but also very focused. Yes. Yeah. So to be that, we're having study group, we are cooking our 2 meals in campus. We used to do those things sometimes, and also eat in the mess. Very cheap food. I remember beans, I think, was 6 bob, ugali was 6 bob, that kind of thing.
Were you involved in like other club things in school, like
in the university
clubs? Yeah.
And I wasn't even aware of them. I wasn't aware of them.
And there were not many. Yeah.
So,
I think SCU didn't quite have much gravitas at the time.
Yeah. So I wasn't engaged in a lot of that. Yeah.
So how does it happen then? You complete your 5 years, and then?
And then we had to ballot to go for our internship. And you're really worried you don't want to go to some distant place, but I knew I didn't want to be in Nairobi.
Why not?
I don't know. I wanted to just have out of Nairobi experience, because I've lived in Nairobi.
Yeah.
And I think it's nice to try something new. So I knew I didn't want to be in, and then it was hard to get Nairobi. So
it was very competitive.
Hedging my bets. I was like, let me pick a place which is not Nairobi. It's very hard, and then you'll compete for Nairobi and miss it and end up in some distant place like Kapinguri or something. I didn't want to go there. So I decided to bet on Nakuru because it's not too far.
Okay.
So, and I got it, and that's where I went to do my internship.
Which
PGH.
Place? Okay.
Yeah. Those days was mostly the main hospital, the PGHs and stuff that we went. And so I did my internship in PGH. That was really fun. Again, another very close-knit community that we found there. The interns, we were one number of us. I think we were about, was it 12 or 16? Because we were divided in 4 rotations, and in every rotation would be 4 of us. So, and you do the rotations for 3 months. So it was a year. You do your rotations for 3 months. And I started seeing, of course, the health system challenges there. In terms of bonding with my colleagues, that was very nice. I naturally took up the coordination of our group of the 4 of us. Being strategic enough to know when public holidays are.
Right.
Anyway, but that was not the main purpose. So just coordinating our shifts, who's covering what, etc. And then we would cover each other. I remember one time when one of my counterparts was the one who was now on duty, and an accident happened, maybe in surgery or something, and an accident happened, and it was horrible. He just had to deal with case after case. So at some point, you now call the rest of us, especially when morning comes and you still have all this. You call the rest of us to come in and chip in, and
whether it's your shift or not.
Yes, and we would do that. I didn't, and I surprised myself. I thought I would like surgery because I thought I wanted to do engineering, those kinds of hand things. I didn't like surgery. So when it came to surgery, I was happy to call anyone else who wanted to come.
Did you ever do?
I did. But if you want to come and assist me, you're welcome. I preferred the medicine and pediatrics side of things, although peds was very hard also. Peds was tough. I remember one day, like 3 babies died in front of us, as in, it's during a ward. We used to have a critical care table where there was a bit of oxygen. We had such limited supplies, so it's just a bit of oxygen, someone is bagging and stuff like that. And then one child dies, and while we're still trying to resuscitate and the mother is screaming, the next one dies.
Newborn?
Not newborn, but under 1. And then the next one, and it was so sad, and we didn't know why. And sometimes that's when you start thinking about the health system and what can we really do, because we needed to have like ICU facilities, better facilities, oxygen, to be able to take care of these babies. And
how does the hospital deal with that kind of thing? Especially, I mean, one death is one too many, but like in such a case,
public hospitals, there are many deaths, because also a lot of people come in when they're very severe. Maybe they've been treated in the community, they've been treated in lower level facilities for so long, so you come in very sick. So chances of dying tend to be higher.
So this, does it start pricking your conscience about like what needs to change?
Yes.
And what your role would be in it?
Yeah, so for me, that's what I would always think about. Or why don't we have normal saline? Why don't we have gloves? Gloves are perpetually out of stock. Syringes and needles, things would be out of stock. It was really bad, by the way.
A very small question for the sake of myself and others. I'm asking this for a friend. Gloves and syringes, when you're getting your bill, that's usually really highly priced.
In a public hospital, you don't get a bill saying gloves or syringes.
Sorry, yeah.
You just get a bill that per day is 2,000 or whatever it is.
Yeah.
It's not broken down. And they were not costed that way. So those are now, again, back to the health system gaps. How do you decide how much is enough? So I finished internship in Nakuru, and I went to Elbagon Hospital, which is also just not far from Nakuru, for those who know it, on the way to, after Njoro, between Njoro and Molo, is Elbagon. So that's where I went to be an MO, medical officer. And now when you'll be thrown into that, and suddenly you have to be an administrator, you have to do all these things which you never learned. You never learned how to manage. You have all these staff who are now looking at you. You're a fresh intern, but because you're a doctor, you're in charge. So that's when I learned the true management and how difficult it is to make certain decisions because you have no resources. I remember very well, we were being given, we were budgeting you're given your allocation that is coming from the government per quarter. And you'd be told Elbagon Hospital is getting, say, 300,000 shillings for the quarter. What are you supposed to do with that?
For everything?
Yes. And then it's broken down very specifically. Fuel, 9,000. Water, 3,000. Telephone, 5,000. Seriously, what is it supposed to do? Yeah, nothing. So that was one source of the funding. The other funding is what we call FIF, Facility Improvement Fund. It's what patients pay. So in public hospitals, you don't get an itemized bill. You come, you register, depending on the level of hospital, it's either 20 bob or 50 bob or 100 shillings to open the file. And then if you're admitted, then there's a fee. If you're outpatient, first of all, under fives don't pay. The family planning, those things you don't pay, and stuff like that. So besides the file opening, you really collect very little. But there was also the challenge of you collect little, but also people were not managing it well. Even the little that you collect, the little that you get. And for most doctors, I don't know if it has improved now, but as I said, you're not taught to manage. You're not taught finances. You're not taught this is an AIE. This is what it means. Your responsibilities when you're made signatory are this, and you can be liable, and someone can cheat you easily.
And the someone here is like the
administrator. There, people who've been there for long who know the system. So I had to learn. Fortunately, I didn't come in immediately as in charge. I found someone there, and he taught me some things. And then I got a new administrator who also showed me some of those things. So I started learning, and for me, I was very interested. And then we'd have meetings.
That part interested you?
Yeah. One of the things which there's lack of equity in a hospital setting is, so the hospital does charge. You'll find like the maternity is charging, but there's occupational therapy, which is mostly for under fives. They don't charge anything. So when they come to the meeting, the hospital management team meeting to allocate the budget, guys are like, but you don't bring anything. Why should we give you money? So it's up to you to say, guys, we can't deny them money because of this, because they don't bring. So you have to actually, everybody has to make their case, and you have to have a basis for budgeting and allocating.
Yeah.
So I found that quite interesting. That whole aspect of budgeting. We had to increase some of our fees. Unfortunately, it's tough, but if you don't have any other source, you're going to grind to a halt and not provide even the basics.
Yeah. The little accounting that you had done during your break is also coming into...
And just basic math.
Yeah. Which you like.
Yes.
Yeah.
So, and just decision making. And if you understand every department. So I made it a point to understand.
One
of the questions that I asked very early in the hospital was, this is a hospital. Why are we only open up to 5 o'clock?
Yeah.
Then it shuts down at night, except for maternity. So guys are like, no, we are too few, blah, blah, blah. And I looked at the clinical officers and said, no, you're not too few. So you guys sort yourselves out, do a rota that will make sure that there's coverage up to night time. And we started opening.
It's just shifts.
Yes.
Managing shifts,
Yeah. So I had to put my foot, no, you have to ask who. I said, you just make sure it gets done. And they did it. And I was proud of that, that we're able to do that.
That's a interesting leadership style. I've observed it with you. You're like, there's a problem. You ask the person, what's the solution? Go do it.
Yes.
Yeah.
Yeah.
That's very interesting.
Yeah. I find I'm very solution oriented. So everything that I look at, for me, it's always, can we find a solution? How do we fix it? And I get very frustrated when there's no solution or people cannot see that, or bureaucracy or other things are bringing in those barriers. So where I have the power to make a difference, I will make a difference.
How long did you serve as a MO?
Just about 1.5 years. And then I moved to the province it was a very odd title. It's an odd title. So at that time, the government had introduced what were called RRI, the Rapid Results Initiative. So one of them for health was to improve the maternal and child health indicators, of course, in 90 days. But then what happened is they kept on for long because it helped. We started seeing indicators improving. And so there was someone in the provincial office who was called the epidemiologist, and he had left. So the PMO whom I had interacted with asked me if I'm willing to come in and step in that position of being the RRI coordinator. Me fresh, only 2 years of work or 2.5 years, coming into, 1 year post-internship really, coming in to tell 19 MOHs, there were 19 districts across Rift Valley province. Former Rift Valley province, to coordinate them and tell them, you need to perform on your maternal and child health indicators and coordinate the data collection. How do you achieve those results? And also these whole processes of the annual work plan development, make sure that people do that. So
that's an exciting adventure.
So I was like, fine, I'll try it. I was not sure what I was coming into, but I said, I'll try. I really enjoyed myself. And that was now my true entry into public health thinking. And just how do you fix problems to the best of your ability? I remember one time, was I in that position? Yes, there was a PS who passed on. I think it's called Nyangito. He was very good. And he's the one who came and said, he went around the country to all the provinces and told all the MOHs and medical superintendents, all the cash you collect must be banked before you spend it.
Sounds
like a no-brainer, like it should have been happening. But what was happening is people spend at source, meaning there's no accountability. You don't even know what you received, and it goes. And he really pushed that message and said, we will be monitoring that. So those became some of the things now I started monitoring. Like, are all the hospitals banking 100% of what they're spending? Then you bank, and then you have to seek approval to spend it, so that then there's accountability. So you learn that, and then you learn that people actually started making a lot of money just by that simple directive.
But there were sort of like, not profits, but you can get by without, this is for the money that is paid. Not
the money that is paid,
by
yes,
patients.
Because the other one will come through the banks. So the money that is paid, and it improved collections, it improved the hospital's ability to do different things and to grow. Then now we started focusing on the maternal and child health indicators, the deliveries, the immunization. I remember looking at immunization coverage and all that. And then we would go around the whole province visiting different districts. So in my travels, and I enjoy traveling, I reached Turkana on one from the northern side, Loitoktok.
It is still in Nakuru, the province.
Yes.
Yeah.
Yeah. So we would go all the way Turkana, all those districts to Loitoktok, visiting, supervision, checking how things are. I found that very fascinating. I really enjoyed it.
Because you're also seeing various angles to community health, to health.
Yeah, to health.
Public health management.
Yeah. And you meet a lot of people. You learn different people, different personalities, different leadership styles, the effective ones, the ineffective ones, and engaging also with communities. And then at some point there, I got trained on community health work. That's how now I got into that space and understood it well, supporting the setting up of those units. So we were very busy, and it was quite, I found it very exciting actually.
Who was the training by?
The
Training?
On community health. It was Gluck. Gluck had started the community health strategy, had facilitated that. So we were trained as trainers that time. They now helped to establish some of them in the province.
So you had quite a background in, before. I'm assuming after that it's LVCT, no?
Yeah, it is LVCT.
Yeah.
Yeah.
How did that transition happen? And and even before that, I'm sorry to cut you. The extent to which you had seen the perennial issues around, the very persistent issues around public health. You've mentioned a bit about just the management, the finance. What are the other aspects that would, like if you go deep into Turkana vis-a-vis like a place like Nakuru, were there, what are those differences in such?
Yeah, in Turkana and places like Narok are the places you'd go, especially Turkana. We went to a health facility and you find it closed, and then you ask someone, where's the health worker? They're like, awacha tuende kumuita. Then they go call him from his house and he comes in with slippers. It's just very easy, very casual. And it turns out he's not even a trained health worker. There's not even a nurse. So maybe you'd find one nurse if you're lucky. There are places where we found patient attendants. Really, really desperate. There is no health worker. And to get there, even for us to get to that facility, we had to get escorts from AP. When we reached Lodwar town,
deep.
You get an escort who takes you there, because you might go through cattle rustler somewhere. You might be raided. It was actually quite scary. So if you've not seen that, it's hard to fathom that there are such hardship places. I keep telling Paul from Central, you guys know nothing. When you complain,
soft life.
It's soft life completely. Because for you, you'll just breathe, you'll just walk 500 meters, you'll find
there is a facility.
Yes, and people. These guys would go very far. And that is the only health worker. There's no electricity, of course. There's no water. Water, you have to go, 5 kilometers to get water. So I remember thinking, this is horrible. It's terrible. Something really has to change. And what happened also was that what became clear is that the Catholic Diocese of Lodwar was the one that had basically tried to set up most facilities in Turkana. It was such a marginalized county that there was very little going on. You'd post health workers there and people would either not show up or they would show up but work for a few, maybe 2 weeks, then disappear for another 2 weeks. So even making sure health workers were available was very hard.
Were those places where like interns would be sent?
No.
No?
Interns were sent to now more of provincial hospitals or large district hospitals. Those days, now they're going to a lot more hospitals because a lot more has come up. It's over 20. It's like, from my internship now it's 19 years. So that desperation for me was quite sad. Just making sure that people can access healthcare. So when I see initiatives to bring community health workers or to go and set up something in a rural place, I'm okay with that. Actually, because of that exposure, I can tell you that devolution has been most helpful to those regions. Because now, first of all, if you're posted there, you're employed by that county. You can't start going to request for, please post me to Nakuru. My family is where, because that was the constant issue.
Request,
And there's also this terrible thing from government perspective where when you get your salary, there's a basic salary, then there's house allowance, which depends on the city, the town where you live. So Nairobi was high, Kina Nakuru were lower than Nairobi. Now Turkana were very low. And then you're given hardship allowance, which was 600 shillings.
Wow.
If you're a single person, 1,200 if you're married.
Your family.
That is supposed to cover. And the cost of going to Turkana, I think, was 2,000 bob. It was crazy.
Yeah.
So what's the incentive?
Jesus.
Yeah.
Okay.
So guys used to just abandon. Most would just quit, go do something else, or go to school, or whatever it is. So it becomes very hard to provide. So the devolution has helped that those counties now are able to hire what they need and make sure those people are there. They're able to also provide the equipment they need, the commodities, the supplies. Supplies are a big problem. Even getting supplies to those places, it becomes very tough.
Yeah.
And data, if you don't have, you can't even see more.
Yeah, no network.
Yeah.
Everything is
Everything
manual.
was manual. Yeah. So then it's given chances for those to do well. On the flip side, I think counties that were doing well before devolution now may not necessarily have thrived as much.
Oh, yeah.
Yeah, because now, I mean, it was already there was a serious and equitable distribution of resources. It was completely unfair. So,
I hope then the health indicators in those places have changed as a result.
I understand Turkana is doing well, so I'm glad. And they keep improving. If we start going to devolution and the current state of health will never finish, it's depressing.
Yeah.
The state of health right now is depressing across most counties. Not all. There's some that are doing well. And then there's some where you can see the leadership are trying, but there are no resources.
Still.
Yeah, because first there's an allocation that's coming from national, and then different conflicting guidelines come through. You can't charge. Mara, you're doing UHC. Mara, you're doing what? You can't. Or you're doing NHIF and you're waiting for your reimbursement. It never comes through.
Which takes forever.
Yeah. So, and then at least what has improved now is the limitation that health money must stay in health. I even liked that fact in the FIF bill that it should stay in the facility, because especially after devolution, the first government, people discovered, health, that's where the money is, because people are paying money. Those millions would go and they would fund the county and the MCAs and their trips and everything, and not health. It was terrible. Actually, the horror stories I had from my counterparts in the county were quite depressing. Yeah. Yeah.
So this is around 2000. That's when what
2008. 2008. I did that work for the province from 2006 to 2008. Yeah.
At that time, there is new leadership in the country.
Yeah.
And I'm just trying to also imagine that period before you transition away from Nakuru into Nairobi. Yeah. What was happening politically at the time and economically, if you may?
Economically, I saw Nakuru be a very vibrant district then, and really grow. And then post-election happened, and I was in Nakuru.
Right.
I was working in the...
Right at the heart of it.
Yeah. Post-election was December 2007, right?
Yeah. And early 2008.
And early 2008. Yeah. So I was working in the PMO's office that time. Something that has always stayed in my mind is we left for Christmas. I had, because I used to work closely with the guys for records. I had Kalenjin, Kikuyu, friends and team members. When we reopened in January, because we could, at that time Nakuru was still okay because most of the fighting was far. They were not talking to each other at all.
Oh, wow.
Like, yeah, I'm not talking. There's a colleague who was Kikuyu, born and bred and married in Eldama Ravine, and married to a Kalenjin. His house was burnt, or he was thrown out and told, we're only sparing you because of your wife. And, it was heartbreaking.
That's horrific.
It was horrific. It was shocking. I joined the team to go to those IDP camps that were set up in Nakuru. And it was depressing. I knew many colleagues doctors. Our homes burnt in Eldoret. Now you're running to Nakuru for shelter, or those areas. I saw in the IDP camps, a lot of people very desperate, children, elderly, everyone. And we had to try and set that up, working with the UNICEF, WHO teams and all that to see what we could do and how do we make sure food is provided. On our part, we're trying to make sure health services are provided, immunization is provided. We had to think about all that, working with the team now from the PMO's office. So going to all those camps, trying to set up a medical center within that.
Is there more readiness now for that kind of thing, or are we waiting for another, issue to erupt and we'll just be running helter-skelter?
I don't know, but if I was to, I don't know. Let me not speak to it because I'm not now in government. I'm not sure how the coordination works, but it was tense. It was very, very tense. It was depressing. We went to the morgue to see those who had died. You see horrible images, the issue of spears and all that in the PGH. So, I saw all that. But the profound one for me that stayed was when we were friends in December. In January, we are not friends. We
are not talking.
Yes. We are not talking. Those are the guys. And then now for me, see, you've gone back. I've come from Nairobi for the holidays. I've gone back in January. And then now the attacks come, the Mungiki now are fighting back, or whoever it is. So it became that you would hear the horror stories of people in Naivasha have been taken out of the matatu, show your ID, and then some people were killed, some people were forcefully circumcised, I don't know what. And I was like, my name is Otiso. So there's no way anyone would believe is anything other than a Kikuluo. So I just stayed put in Nakuru until things come. Anyway, it took about a month or 2 months. And then there was I remember a med soup in Naivasha who was Luo, who had done a fantastic job. He had to go hide in the police station. And eventually now it was okay, he could leave, could escape. So it was... These are horrific stories. You're in the call of duty and all of this is happening, but you also are putting the patient at the center of this. Yeah. So that we should never allow that to happen again. Unfortunately, I don't think we've learned. And the way people talk, the casualness. And sometimes you interact, someone was telling me about someone from Sudan, I think, or somewhere was talking and saying, you Kenyans have not experienced war. And many of you just talk carelessly. With war, it doesn't matter how rich you are. It doesn't matter how many dollars you have or cash. Because if the cash is in the bank, remember we couldn't access airtime.
Wow.
During that, at that time I was in Nairobi and everything was closed and there was no airtime for people to access. There was no M-Pesa that time. So it was difficult. Maybe one shop would open. I was like, thank God I'm on postpaid, I think, at that time. The milk, I had a young child, you know where are we going to get these supplies? So it was very scary. But I think Kenyans, and especially now we have a lot of young people who don't know how that situation was and have also not interacted with these other countries around us that are always at war. And they're like, you are in your mansion and you're under attack, you take what is on you. Even if you had kept how much money in the house or what,
that's what
you leave it and you go and you become a refugee with nothing. And we don't know that. I don't think as Kenyans we've ever appreciated that and how serious it is, and how you want food, there's no food. You want healthcare, there's no healthcare. There's no transport. You want to move from point A to, you're like, I'll go from here to here. You have to walk. Rich or poor. And then that is when now
war is an equalizer.
Yes. And the fight now becomes also haves and have-nots. And that we saw that with the post-election. There was also incidences of just it became haves and have-nots by the way. Yes. So,
wow. A moment in time.
So that was profound for me. But I left Nakuru after that.
You've mentioned your child at the time, so you've also started a family while in Nakuru?
Yeah. So I had a family, I had a child, so I would stayed with her in Nakuru. Then at some point, because of moving around a lot with the provincial, I moved her to Nairobi. Yeah. So that's what informed my decision to now move from the province to Nairobi.
That decision, was it brought also by an opportunity, or you really wanted to?
I really wanted to move, so I was now actively looking. Yeah, so I interviewed with LVCT then. I wasn't called the first time. So in the interim, I got an opportunity with AAR. I was like, clinical work, but it's okay. I get to move to Nairobi. So I moved and I worked in AAR for exactly 2 months. In like mid-2008. It was a good experience because what I did is I used the same lessons I had from the province. At that time now they were trying to set up, or they didn't know what to do with HIV. So I was like, I'm the expert, because I had been involved in setting up HIV clinics, supervising HIV work.
Largely testing, but also
and treatment. Treatment had just, treatment programs are being rolled out. So in the province, I was involved in rolling out treatment programs. And I remember even in Elbagon setting up the first CCC there for the patients who would come. So, and we got trained. And I was also, I remember I was trained in supportive supervision, and one statement someone once told me is, "You're so nice about this. You know, we're so used to being, it's always about fault finding." And she's like, "No, I like the way you've done it." So I was like,
okay,
is
different,
good. So I have used my lessons well, but also it is important that I use that in my future. So came to AAR, within those 2 months, started having conversations about how they would set up the HIV clinic. I wasn't planning to leave, but LVCT called and I was like, I just wanted to go to an NGO. I don't want to see patients. But there I was very clear, I didn't want to see patients. Yeah. And especially private patients. I didn't mind public patients, like when we're in Elbagon. They're truly sick and they're truly appreciative of the health workers and what we do. And then you come here to private patients, and because someone has insurance, they feel they have to come to the hospital. There's an entitlement.
And I want to use this health insurance I've paid for anyway. And
I want Zinat. I don't want to do which drugs. I'm like, and you became a doctor when? Sorry, anyway.
No, it's true. It's true. I think, it's very relatable to many.
And we noticed that, like on Sunday afternoon, Sunday morning was quiet. Everybody was in church. Sunday afternoon, the clinic was full.
Because guys want a sick off for Monday.
No, my child was sick during the week. Just check, make sure that they are fine. Yeah, I see this boy able to tell the doctor the kid is running around. So I was like, see, if this was a public patient, they would not be in hospital.
Really, really sick.
Yes,
if they're here.
Yes, and not to make it sound insignificant. Yeah. But I really was clear that this is not me. I can't deal with this. I'm not excited treating colds and flus. Yeah. And for me, I'm all, as I said, solution oriented. So there are many things that need to be fixed. So just the colds and flus for that happened on Wednesday, and we're just reassuring. Very frustrating. Yeah.
No, I see that very, very much. So the same position that you applied for LVCT is what they called you for?
Yes. So
care and treatment?
Care and treatment manager. So I joined in August. Is it August? Yeah, in 2008. And I've never left.
That journey, we will come to it in a minute. Let's take a quick water break.